welcome back to your Feel Good Breakfast Show. It's so good to have you here on this beautiful Tuesday morning. It might be chilly, but listen, we're definitely going to keep you warmed up and also informed because it is Health Tuesday, and I've got a fact for you that might just shock you. Listen, every 30 seconds, someone dies from a hepatitis-related illness. That is something to think about, and that's according to the World Health Organization. Now, World Hepatitis Day, observed on the 28th of July, raises awareness about viral hepatitis and the urgent need for better prevention, diagnosis, and also treatment. And this year's theme, it's time for action. Yes, it sure is. Emphasizes the necessity of swift measures to combat this silent epidemic.
Yep, and this morning we are joined by Dr. Chanel Martinezson, a medical doctor from Inno Health Medical Centers, to discuss the current state of hepatitis, the challenges that we face, and also the steps that we can take to move towards a goal of hepatitis elimination by 2030. A big goal, Dr. Chanel. Good morning.
Good morning. How are you?
Good. Thank you very much for joining us. Yeah, I don't think we've ever, or I have ever covered hepatitis in a chat like this, and it's shocking. Every 30 seconds.
30 seconds.
Which means it's quite prevalent in our communities, and I believe so. We spoke about it in South Africa as well.
Yes, yeah, no, definitely.
And we don't talk about it often enough, considering this fact as well. But let's get down to the basics. What is hepatitis? What causes it? How does it come about?
So it's in the name, hepatitis. So hepa refers to liver. So our livers sit over here on the right. And then itis usually refers to some sort of inflammation. So it is the inflammation of the liver. It is usually caused by infectious agents like viruses known as hepatitis A, B, C, D, and E. First 5 letters of the alphabet. And then there are non-infectious causes such as alcohol, drugs, and toxins.
Ooh.
Yeah, so there's 2 different ways you can look at it.
Oh my goodness.
Can I ask you, because I mean the crazy stats that we've just unleashed this morning, every 30 seconds, why aren't more people getting tested? Why are we not seeing that? What is going on?
So I think the first step is days like this, the world awareness, hepatitis awareness, and to get us to talk about it. But sometimes a lot of patients are walking around with it because they're asymptomatic. So you actually don't even know that you've contracted hepatitis because you're actually asymptomatic. And then later on, when it becomes, very bad, then it actually shows itself. When it actually becomes, it can differ in the ranges. So it can either be from mild symptoms to self-limiting, which self-limiting means it will stop by itself without any treatment. Your body just helps itself. Or in severe illness, you need a liver transplant. So it can range, the symptoms can range, and sometimes patients don't even know that they have it.
And is there a specific trigger? If you are somebody that's walking around with it, you're asymptomatic, are there triggers that will kind of just switch it over to that infectious part?
So like I said, if you contract the virus, so there are different ways that you can contract the virus. Hepatitis A and E is usually via the fecal-oral route, so that is from contaminated water and food. So there are some places that are, more prevalent with that.
Right.
And then B, C, and D are contracted parenterally, so that is like in mucous membrane, saliva, things like that, from mother to child, and then also sexually transmitted. So patients don't even know that hepatitis can be transmitted sexually also.
Right. Yeah. And then how do you get tested? You maybe notice some symptoms, you go to the doctor. What is that process?
So you can either, just get a blood panel done. The doctor can draw. We can do the hepatitis, we do the surface antigens, antibodies, all of that. A whole panel of tests that doctors can do. And then we can see, have you actually received any immunization? Did you know that it's actually in our immunization schedule? So when kids go to the clinic, from 6 weeks to 18 months, they actually get the hepatitis B vaccine in their schedule. So there's actually 4 of the vaccines that they get in that time period. So you can test for it. The doctors can test. You can either go and just to test before you even have any symptoms, but other patients will present either with malaise, fever. It's very non-specific symptoms, so you're not even sure. The jaundice maybe sets it apart, the yellow eyes and, the yellow mucous membranes, but in general, it's that fever, malaise, nausea, vomiting. Sometimes then later it will be the liver pain and itchiness it can actually present with that as well.
We'll chat about the symptoms a little bit later on as well, but I mean, let's talk about the more severe problems here. You mentioned liver transplant, even cancer. Is that where it can develop into if left untreated?
Yes, definitely. So it can hepatitis can further be classified into acute and chronic. So hepatitis B and C are usually the culprits for the chronic disease, and that usually progresses into liver cirrhosis, which means there's scarring of the liver, and then, the liver cancer. So it can progress into that. Not so much the A and the E ones, but, and then also what people don't know is that if they have hepatitis D, they also have B. So, it's...
so it's like a bit of a combination going on there. Lifestyle factors.
Yes.
What can people look out for? I mean, in general, living a healthy lifestyle, but I mean, we don't know. We might be walking around with it. What would you say are those important lifestyle factors to make sure that you look after your liver?
So be kind to your liver. So, like I said initially, alcohol, medications. We've seen a lot of patients in hospitals with drug-induced liver disease, where it's actually from a medication that they've taken. So obviously drugs and toxins. So living a healthy lifestyle, like you said, is probably a good idea. And then also in terms of hepatitis A and E, we can, wash our hands, make sure we're eating clean food, rinse the food. You don't know where it's coming from. So just obviously in some areas that can't be prevented. But
Doc, you've given us so much information, and my eyes are being opened right now to a world that I don't think I really have ever delved into. So thank you for this, but I know you're not going anywhere. We've got a part 2 with you in just a bit, and I can't wait to get into that too.
Yeah, we'll get into more, especially in those signs and symptoms, also the vaccine that Dr. Chanel mentioned a little bit earlier on. But for now, let's shine the spotlight on some other true heroes. It is now time for our Pharmacy of the Week. Our salute to the remarkable individuals leading the charge in healthcare.
Yeah, and today we pay tribute to Viachem Pharmacy out in Muscle Bay, proudly brought to you by Adcock Ingram OTC, sponsors of Brave.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show here on S3. We are now continuing our conversation with Dr. Chanel Martinezson, who has been shedding a rather important light on the critical issue of hepatitis and the importance of timely action. Now we're going to delve into the steps that we can take to protect ourselves from this rather silent epidemic with crazy stats. Every 32nd, somebody passes away from a hepatitis-related illness. Thank you very much, Dr. Chanel, for joining us once again this morning. It's lovely to have you. I had no idea it is so serious. It really is like that silent killer that we're talking about. We were just talking about off air. We walk around, we might not even know up until the point where it is either too late or we need to take some serious action. The common symptoms and signs of hepatitis, I know you mentioned a little bit earlier on, but for those who've just tuned in, what should we look out for, especially with so many different variations of forms of it?
Yeah, so the clinical presentation is very non-specific, so it doesn't look like clear-cut, this is hepatitis sometimes. It is very generalized, so it is the malaise, where the body's just very tired and painful everywhere, the fatigue, the nausea, vomiting, fevers it can come with, and then obviously the jaundice, so yellow eyes, yellow...
I think once you've reached that and once you look at yourself and you see then you should know and act.
Yeah, depending on the cause, it will present itself differently. So it can be different severities, the modes of transmission, the global distribution, and even the way that it can be prevented. So patients just need to look out for those things. And if obviously they need to speak to their doctor. If anything is out of, if they're just feeling a bit off, they should then, check, because we can do blood tests to check.
Yeah, absolutely. And we're looking forward to, of course, World Hepatitis Day on the 28th of July. And this is really all about just starting those conversations, because it seems that there's quite a lot of knowledge around the different forms of hepatitis, but still, I don't think enough people are talking about it or taking it on board. Is that why a day like this is important in your world?
Yes, I think it's the first step to create the awareness and to speak about it. So now I think you've been enlightened today.
Yeah, for sure.
So I think it's important, and I think that now going forward, people listening to us now, and on Sunday, we should just, it is observed as the World Hepatitis Day.
If someone is presenting with those symptoms and they suspect, what are the first steps? What are the treatment options available given hepatitis A, B, C, all the different forms?
So the general measures that we do is actually bed rest. So we actually rest the liver, rest the body. And then we'll do things like, so treating the symptoms. So treating the nausea, the vomiting, the fever, we'll treat those things. And then there are also antiviral medications that patients can take, but that will obviously be administered by a doctor, depending on the type that caused it. Like I said, the 5 different types, and the severity of it. And also it can be either in the acute or the chronic phase. So it just depends where that patient comes in. The treatment will differ. So everybody's different. Everybody's bodies will react differently.
Absolutely. Can somebody make a full recovery after being diagnosed?
They can, but like I said, depends on the severity.
Okay.
So if it's like with hepatitis B and C, it leads to chronic disease, and it is usually the ones that cause the liver cirrhosis and liver cancer. So it can progress into cancer. But if it's just, like I said, self-limiting, some patients' bodies treat it by themselves. So it ranges, from no symptoms to needing a liver transplant.
So it's really in your best interest then to rather go and see a health professional and maybe get the blood work done.
And the vaccine is a good idea.
I want to talk about the vaccine, especially because as parents, you want to give your kids the best fighting chance going forward and protect them against all these different illnesses out there. The hepatitis B vaccine, I know that there's a lot to say about many vaccines out there, but this one particularly I feel is very important. Why should parents especially put a lot of emphasis on the hepatitis B vaccine for kids?
Because I think, like we said, kids are walking around, they don't even know. It can be transmitted from mother to child. So sometimes the mothers don't even know that they have it. It is a sexually transmitted disease, so, it can happen anywhere to anybody. The kids, obviously, we want to give them the best chance, like we said. So within our immunization schedules that kids go for, the hepatitis B is within that very long name in the book, in the clinic book. The hepatitis B vaccine is actually within that name. So, and they get 4 of them. So it is very important that kids get them before they even become, infected, so that they can be immune to it when they are exposed to it later. Because the modes of transmission, kids can just, pick something off the floor, you don't know where it came from, what it is, and they can actually just contract with hepatitis A or E.
My goodness, you got so much information this morning. You think you understand everything and then you come through with something else. But it is good because it's a good thing that it is understood. However, we want to get that message across out there as well. Lastly, how do we protect ourselves and our families? I mean, just some of your lifestyle tips, I suppose, in terms of, safeguarding ourselves against contracting hepatitis.
So the non-infectious causes, the viral infectious causes, that can be contracted in different ways, and that's a different story. But the non-infectious causes, our livers actually do so much for us every day. They have so many functions vitally that some people don't even know it's from the liver. So we should just be kind to our livers, I think. Try to protect it from not too much alcohol, not too much medications, drugs. Everything will go through most things go through the liver.
That's like your filter.
Exactly.
Really, and that's why it's important. If you look at it like that, as your filter, I mean, if your filter's clogged, you can't breathe. You know what I'm saying? So this filters out all the toxins.
Exactly. So you'd like to protect it as far as you can. And then the very common thing, wash hands, wash the food before you eat it. Try to keep informed and educate even the children about what hepatitis is from a young age.
Fantastic. Dr. Chanel, thank you very much. It's been a lot of information, very valuable information at that as well, how we can protect ourselves and our families from hepatitis. Awareness and timely, I think, intervention. Those are the key things that will make a difference in the long run. And if you would like for, to Dr. Chanel, she's very efficient on the socials as well, Dr. Chanel Martinez, at Dr. Chanel, you can find her there, and also at Inno Health Clinics. Maybe that's your one-stop shop to get some information. Go follow. Thank you, Dr. Chanel.
Thank you.